I want to start before talking about how I treat and sequence therapies in metastatic RCC. I want to start by mentioning a new target, which now we've seen studies presented in the HIF-2 inhibitor MK6482. HIF-2 has been really a very hard target. For many years, there was an attempt to target HIF-2, which is at the central of angiogenesis in clear cell RCC. And only a few years ago, there was a small molecule, first in class, PT2385, and now MK6482, which improved PK properties. And we presented an update at the GU Cancer Symposium in over 55 patients with metastatic clear cell RCC that showed a response rate around 24% in a very heavily refractory population progressed on prior, their cancer progressed on prior VEGF inhibitors and immuno-oncology drugs. So this is really a proof of principle, and we're taking this drug to a phase 3 trial in a population, same population post-VEGF and IO. The drug seems to have different side effect profile, the small molecule, than VEGF targeted therapy. We see anemia, which is on target due to erythropoietin downregulation. We see some hypoxia, but usually the diarrhea, the fatigue, the hypertension, which are side effects from TKIs, VEGF target therapy, we don't see them. So actually, as a proof of principle, that's very promising, a new target, new way how to treat renal cell carcinoma. Obviously, this is not FDA approved. And at the 2020 ASCO, Dr. Jonas from MD Anderson presented also data with the same agent, but in VHL syndrome. And these patients had clear cell RCC, all of them, but also had other lesions, part of the VHL syndrome spectrum, like hemangioblastoma and others. And again, response rate were in the same range, and a lot of unconfirmed responses. So with more follow-up, these could happen with the same spectrum of toxicity. A total unmet need. Dr. Jonas talked was in the non-clear cell variant, histologies. Very promising target to build on, and welcome the kidney cancer community, welcome that. So I think that's something the next few years to look at.